you, and then we will get going. All right. Hello, everyone. I'm Christopher Locke. I'm the IBPA member liaison, and we're doing this webinar series called Get to Know Your IBPA Member Benefits, because we want to give everyone an idea of all of the benefits that they have, and these are a more in-depth look at them. So today we're covering IBPA's health insurance program, which is in partnership with Lighthouse Insurance Group Solutions and 10 other associations called the Book Industry Health Insurance Partnership. So I'll put in the chat in a bit some more detailed explanations of that. But let me introduce our wonderful presenter today, Tim McNichols. After serving as Director of Business Development and Corporate Marketing, Tim McNichols has been promoted to Executive Director of Partnerships. A graduate of Cleveland State University, McNichols has an extensive background in working for and with associations, media companies, and marketing organizations, and has driven LIG's association and member-based organization insurance partnership programs to include agreements with more than 50 groups nationwide. All right, so again, we want your questions, so put them in the Q&A. I'll be monitoring those. I'm gonna go away, and Tim is gonna take it away from here.
Sounds good. I'm gonna turn off my video too, just so that the video file is not as big, so we're gonna do that, but I appreciate everybody joining us today. I want to do a couple quick housekeeping items. First and foremost, I wanted to thank everybody for joining us today. Today's webinar is scheduled for about 45 minutes. We're going to do about 30 or so on the presentation itself here, and then we do a Q&A session, which, you know, as long as we need to and as many questions as we have, but typically about 15 minutes or so on that. If you do have questions, obviously Chris has pointed out, use the chat function on the Zoom call here, and you can put those in and we'll get to those questions here at the end. Obviously this is being recorded today, so if you need to come back and view this later or want to share it with any coworkers, or have questions that I touched on, you want to get that detail again, please feel free to do that. And I'll have a couple different points here where I'll share some contact information for our organization. But if you do have any immediate feedback or have questions, you can always send an email to ligmarketing@ligquotes.com. And that's our general box. I'll share my actual email address here at the end of today's presentation if you have specific questions for me. With that, I wanted to welcome again everybody to this presentation. We are going to go over the IBPA health benefit program that we have for not only this organization, but all the book and author related organizations that came together just about a year ago to make this program happen in a reality. We're going to spend some time discussing what the options are today. Wanted to also give you a quick note on who LIG is. LIG is a national brokerage. We're an insurance company that's based out of the Cleveland, Ohio area, actually in Independence, Ohio, if you're familiar with the area. We were founded in 2009. And at the time when our founder and current president, Jason Farrow, founded the company, he had been working within the health insurance industry for a long time. He kind of grew up in it. His family had a large brokerage group side of things. And this is just before the Affordable Care Act became a reality. And at that time, Jason knew that people would need help kind of navigating the new landscape that the individual market was going to bring to people. It was new, unprecedented, just not had happened that way before. So that was kind of the genesis of the company back in 2009. And since our founding, we've grown to be a national brokerage. We have coverage options in all 50 states. We're licensed in all 50 states. We handle under 65 and over 65, so includes Medicare. We work with individuals and families and groups, so business owners, to get coverage for their employees. The one thing that I'll probably hit on a couple times today is that our program is not a true group program, so you're not getting a group rate because of everybody else's participation. This is not an association health plan, but this is something that we've put together that allows access to health insurance options, affordable health insurance options that fit your financial and your health needs. Spend some time talking about that today. Something that we're very proud of in putting this together, this program together. And as Chris pointed out, we work with a lot of associations. We've actually, since that bio was put together, we actually work with over 80 organizations today, and that'll soon be closer to 100 as we get a little bit later into this year. So we're excited about that. So today, what will we be covering? So basic agenda, we're going to go over options when you look at, if you've lost coverage, need coverage, what are your options for 2021? There's been a lot of things that have happened over the last year that have impacted people's health insurance, either through an employer or on the individual market. And we're going to spend some time today talking about that. So it's, focused around you, your family, and, your business potentially with your employees. That's kind of where we'll kind of talk about that. And that'll be the first part of the presentation. The second part is we're going to go over the specifics of the IBPA health benefit program and what's involved with that. How do you get access to it? Obviously it's a member benefit. So if you're a member, you're getting a lot of correspondence or have gotten correspondence about this program. And if you're not a member, we obviously encourage you to join to take advantage of the program, but we'll go over that today. And finally, we'll wrap up with a Q&A session to really answer any questions that you may have. And there are no silly questions, and we encourage you to ask as much as you can, and we'll try to get to all those today. So with that, when we start looking at what is new in 2021, there's a few things that have happened since the beginning of the year, which I think are important to note. And a lot of people don't necessarily know or realize that this is happening. I think most people understand with a lot of health insurance, it's typically done at the latter part of the year. October, November, December is when a lot of people typically are looking at their health insurance. But because of the pandemic, the new administration opened up a special enrollment period, which is rather unusual. It doesn't happen very often, but this special enrollment period, or SEP, started on February 15th and is now set up to run through August 15th. That may be extended, but for now it runs through August 15th. And it basically is set up that if anyone has been impacted by COVID, which really is about everyone out there, you have access to all available plans. That means all the ACA, Obamacare style plans, all the typical plans you get outside of open enrollment, which are a lot of the off exchange or short-term plans. All of the things are available right now, so you don't have to wait until the fall to enroll. And that's really important, and it's a big deal. There's also been some changes with the HRAs, which is the framework for the group offering that we have for businesses in a positive ways. And we'll go over a little bit of that today, but we use that HRA, which is health reimbursement arrangement, as the framework for our business W-2 employee offering. There's also been another substantial change for individuals that in the past may have found out that they didn't qualify for subsidies. As part of the American Rescue Act plan of 2021, there was a major change in how subsidies are calculated and how and who actually can qualify for subsidies. In the past, a lot of people that made over a certain dollar amount, it's based on your total income, number of people in the family, things along those lines. A lot of people found out that they made basically too much money, didn't qualify for a subsidy. I think most people will be surprised now to find that the average American will finally qualify for subsidies. And as in the past, people also found that they basically a cliff. It just ended. If you hit a certain dollar amount in income based on your family size, it just ended. Here, it's more of a gradual downhill. So as you make more and more money, your subsidy goes down, 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 until you get to a point where you're basically what I think most people consider wealthy, and you're not going to qualify for a subsidy. So we encourage people that if you've looked at subsidies in the past for you, yourself, your family, and haven't qualified, take a look at it again. That's where we'll help you go through all that, make sure you get those. Some other elements are COBRA. Either if you've been receiving COBRA or if you are a business that offers COBRA, you've probably heard that there were changes made to this. Basically, the way the program was set up with the new American Rescue Act plan of 2021 is that people that have had that would be qualified for COBRA could actually get COBRA coverage through basically the end of September at no cost. They have to go through their former employer to be able to do that. I know there was a lot of confusion about that. We'll talk about the basics on that today, and if there's questions that you have on that, we can answer those either at the end or offline if you want to get into the specifics of that. The last aspect of things that are not necessarily new, but are a lot of the questions that we've been getting since this program became a reality, is the status of the association health plans. And as it is right now, there hasn't been any change. They're still on hold. They're not going to happen anytime soon. We're actually waiting for some things to happen because there's been some legal challenges to the idea of association health plans. But based on the current administration and some of the people that have been put in place as far as the directors and those responsible for the governance of health plans, health insurance, things along those lines, we're not very hopeful that they're going to approve the association health plans. And the real reason on that seems to be that they don't have to follow all the tenets of the association or of the Affordable Care Act. And that's probably the biggest reason that they're not going to go forward as they are designed today. So we're not hopeful for that, and we're always watching for that. And it's something that if that changes, obviously we will work with all the associations that we work with, as of course all the book and author and related organizations to see how that can happen. But on a national level, we also know that it won't happen because states like California, New York, and a few others have already said that they will not allow the residents of their states to participate in an association health plan. So that alone has put the kibosh on it ever of being a national solution. So unfortunately, we know some things now, but knowing that it will never be a true national solution, is a for sure. Again, if you have questions on that, we can answer those kind of at the end. So we're going to get into like what's available here in 2021. And I think, again, I'm going to breeze over this slide, but the idea that we have lived through or living in an unprecedented time is kind of an understatement with everything that's happened in the last really 18 months now with COVID and everything that's going on there. We're constantly hearing, changes on this, uncertainty on that, all the stuff that's happened with the mask mandates over the last week. But, the one thing that we do know is that, even with the past administration, believe it or not, there have been a lot of proactive things put in place to help people or make sure people had access to health insurance throughout this process. The past administration, had different elements put into it. The new administration has done the same thing. And that's where, we can answer, some of these questions for you today and get into the ideas of what is available and, let you understand that, through the program as a member of IBPA, that LIG is here to assist you and help guide you on this and kind of go through those programs. We start looking at what are the options. First and foremost, the Obamacare or ACA plans. Those terms are kind of interchangeable. They basically mean the same thing. But if you hear ACA, it's the Affordable Care Act, which is the formal name for what is kind of loosely known as Obamacare. But basically, this is a plan through real insurance companies. That's what we work with that have real coverage, and this is coverage that has to cover you for pre-existing conditions. It's not group rated. It's not based on anything that's going to impact you from a health standpoint. The only real things that you have to be concerned with, they are going to look at your income if you qualify for a subsidy. And then after that, it's who needs to be insured. If it's you yourself, you and yourself, or if you're looking at your family, those are the things that would be looking at. They can impact things like smoking, but if you have had chronic issues like diabetes or heart conditions, cancer, or other pre-existing conditions, those all have to be covered underneath the Obamacare or ACA plans. Women's health, mental health, all those things are covered as well. In the past, as I've mentioned, you could get access to these during what is typically the open enrollment period, which is for most states, November 1st through December 15th. Some states open it up a little bit later, but that's the typical timeline for most states around the country. Outside of that, you would have to do it through either a qualifying life event or something along those lines. And qualifying life events typically are like birth, death, marriage, divorce, you've adopted a child, you've moved, even becoming a naturalized U.S. citizen would have a qualifying life event attached to it. And that would allow you to have access to those types of plans for 60 days. Obviously, with the special enrollment period going on right now, that opens it up to everybody. It doesn't matter if you've had a qualifying life event or not. And just as a reminder, that goes through August 15th currently. So if you are looking for coverage options and you want to make sure that you have that ACA type plan, that is your kind of time constraints. Another element that people have or another access point is what do they call short-term coverage options. These short-terms are off exchange plans. They're done a little differently. They do not have to cover you for pre-existing conditions, and they typically don't. They are usually underwritten, so you have to go through an actual underwriting. If you've had things like a pre-existing condition like diabetes or cancer, some of the others that I mentioned, they're not the best plan for you. It isn't something that we would typically offer to you. But if you are healthy and you don't have those existing conditions, these can be great options either for a short period of time, typically 3 months. You can even go month to month, but a lot of times people will get this in lieu of COBRA, because COBRA does have some extra cost added to it if you're getting traditional COBRA coverage, or if you're making a jump, starting a new business, you need temporary or short-term insurance, but they can actually be used for longer periods of time as well. So it really comes down to doing needs analysis with you if you're looking for coverage options like this, and we would be able to make recommendations. These are available all year long. You don't have to have that QLE. They're not based on any of the open enrollment periods, because you can get them at any time of the year. But they are a good solution for a lot of people out there. We find too, especially a lot of younger people that don't go to the doctor very often, and they just want to make sure that they have basic health insurance. This is a good option. That individual just getting out of college, getting their, need their first health insurance, and they've aged off of their parents' plan, that kind of thing. So a lot of elements like that. Again, kind of keeping in the major medical realm, two other things that a lot of times people confuse, and that's why I actually put them on the same slide, is Medicaid and Medicare. Really need to explain the difference, but if you are Medicaid eligible, typically it's meant for low income people that are, families, children, pregnant women, elderly, people with disabilities, people that aren't going to qualify for, from an income level that you are going to get this 100% at no cost. It's typically the same kind of insurance. It's not bad insurance, just Medicaid insurance. It's done through the state typically. It's not done on the federal level, so this is a state-by-state basis, and you go through and you actually apply for it through the state. But I don't want people confusing it with Medicare. Medicare is something that we do here, and it is set up for people that are 65 and over. There's a lot of different elements to Medicare, and it's something where you can talk to one of our licensed agents here. They'll be able to go through your options. If it's a Medicare Advantage plan, which is basically taking and making the typical Medicare health insurance look and feel like a traditional group plan that you may have had from an employer, or you can actually take your Medicare and add the supplemental coverage in it, like your Part D, for drugs, for example, things along those lines. But for us, we're going to have a conversation with you and that needs analysis to really see what makes the most sense if you're in that range of, being Medicare eligible, if you have a family member that's in that, or even employees, we'll be able to walk through that process with you. But just wanted to, make sure that you understand that there is a difference between Medicare and Medicaid. Medicare is 65 and over, and Medicaid is typically for low income, extremely low income individuals, families, children, pregnant women, and elderly people with disabilities. So it really does have a difference between those two. Another thing, obviously, we've talked about this a little bit, but is COBRA, which is the Consolidated Ombudsman Budget Reconciliation Act. It's a mouthful, which is why they go by the term COBRA. But this is a way that you can continue with a group plan if you've left an employer, either by choice or you've been asked to leave, where you can continue for a specific period of time your health coverage, basically the exact same plan. Biggest probably issues with COBRA is that there's larger fees. You're now paying for the 100% of the premiums, where usually you were having that shared with your employer. Plus, you have a service fee basically added onto that. And a lot of people find, even with this new plan that they put together with the change in COBRA, that you can get your coverage at no cost through the end of September, a lot of people don't understand or realize that they could probably get better or more effective coverage at a lower cost if they go through, say, the ACA. The one thing I always like to warn is that if you choose to keep COBRA or go through this program that was put in place, your coverage ends at the end of September, and you're going to need to look for additional coverage. So if you had a medical condition between now and then, and you needed to continue with that, you'd probably have to then buy into your COBRA plan to continue that coverage versus going and getting something on the ACA. And I think a lot of people, especially if they're still in financial constraints with job losses, things along those lines, that they're going to have a better benefit potentially on the open ACA market as opposed to keeping with the COBRA coverage. And on the major medical side, this really isn't coverage, but we still find that a lot of people are choosing to not carry coverage, and that is definitely a personal choice. But we also encourage people to look, because of all the changes that have been made. You're going to be very surprised about how affordable coverage can be. and it's usually to your benefit to keep or have some type of coverage, just not knowing what's going to happen. So, for us, it's really never an option. We always encourage people to look at getting some type of coverage, and usually there's something that can be, very cost effective, either with the new subsidies that are out there, or some of the bronze plans, or even some of the short-term plans. You can find something that's very cost effective that'll cover you in the event that something does happen, so that it doesn't impact you financially for a long period of time. And then kind of lastly, we've breezed over a lot of the what would be considered major medical, but there are a lot of other coverage options that people do look at and are part of the health realm of coverage options. But things like vision, dental, even life insurance, critical illness, hospitalization, plans that people typically have as part of a business plan that they may have had from an employer, or just know that they need to go see a dentist or an eye doctor on a regular basis. And these are all things that you need to account. Obviously, it's things that we deal with here. And then you start looking at, obviously, the business solutions that we have with our group HRA program. But these are all things that are, available today currently. There aren't any magic bullets out there, but there are a lot of affordable options. And, really it comes down to what is your situation, both financially and from a health standpoint for you, your family, and then looking at the same kind of approach for a business if you're looking for coverage options for your employees. But the biggest thing that I can stress with all of this is that if you need it, have questions, or just really anything, ask for help. That's what we're here for, and that is part of the member benefit that is available to the members of IBPA through this program. So there's no cost to work with us. There's no extra fees. You're never charged commissions. If you do get a health coverage option through us, you're paying just the actual premiums for individual and family coverages. There are some administrative fees if you do the business plan, but those are nominal. But the idea at the end of the day is ask for help, and that's what we're here to do. So what I wanted to do now is we're going to transition to kind of talking about the specifics of this program, for the members of IBPA. And, again, I'll stress, if you are not a member, highly encourage you to join. It's a great organization any way you look at it. Outside of, offering this health benefit, there's a lot of things that the organization has that I think you'll find advantageous to you personally in your career. But, obviously, I'm speak very highly of our insurance program that we have, because, well, that's what we do, but it is a good program. So we'll spend some time talking about that here. So when you look at, what is this new exclusive member benefit, it is open to all current IBPA members. I think I mentioned this earlier, but it is real insurance. This is not a discount program or a network plan with limited benefits. We work with just about every single carrier that's available throughout the United States. And again, major medical, Medicare, all the supplemental coverages. I mentioned earlier too that there's no additional fees or any additional costs outside of the premiums for individuals and families. There's access to coverage year-round. We spent some time talking about that here today, and we live in a kind of a unique time with the special enrollment period. But there are coverage options available throughout the year, and all the plans they're stock plans. We're not creating anything from scratch, but these plans that we pick and work with you are designed to match your health and your financial situation. And I think that's really important, especially on the individual and family level, but especially when we get into the business realm, if you're looking at coverage options for your employees, yourself and your employees. And speaking of that, if we do have a conversation with you about a business solution, did want to point out that we do work with our partner, PeopleKeep. They're basically a software, they're a back office administrator for us. They help make the HRA process really simple for us. And if you have a conversation with you, at some point we would bring PeopleKeep into the conversation. But again, they help kind of administer the program on the back end. I kind of look at it as a donut. We do all the stuff except the part that's in the middle, and that's where PeopleKeep helps us with this program. But just wanted to point that out, that if we have that conversation with you, we would be bringing PeopleKeep into the conversation. And I think this is the next real big part of everything that we do with this program for, not just IBPA members, but all the associations we partner with, that this is about choice. This is not, as I mentioned earlier, a one size fits all group plan where it's kind of that, traditional, here's what you get. And if it doesn't fit your exact needs, I'm sorry, try to make it work. This is about choice. We're going to be able to work with a lot of different carriers. And in most markets, we're going to be able to find a lot of different, solutions options for you, and it comes down to then finding that best one that fits your individual and your family needs. This is real insurance with real insurance companies. It's just a sampling on the screen of some of the ones that we work with, but Anthem, United Healthcare, Blue Cross, Medical Mutual, SureBridge, Humana, the list goes on. And really is based on where you live at and what it is that you're trying to do. If you travel a lot versus stay in town all the time, that's going to kind of dictate the kind of coverage that we're going to make recommendations for. It really does not just include financial and health, but even lifestyle. We're compliant across all 50 states. This is done concierge style. This is the unique approach to this program, is that we pull everything together for you. You're going to work with one of our licensed agents one-on-one. A call with one of our licensed agents is going to take about 20 to 40 minutes. And our licensed agents are our employees. They're our W-2 employees. They're not set up to, push a particular plan. They have no idea what our commissions are on any different policies or anything along those lines. They are there to find the best possible plan for you. So they're paid on a salary plus bonus, and their bonus is based on their performance. It's not based on selling one plan over the other. And we set it up that way because it is that concierge approach. We want them to work with you to find the best possible plan and do all the heavy lifting for you. Again, a call is going to take about 20 to 40 minutes. We're going to be able to go through and verify doctors, hospital networks, prescription drugs before you even make a decision to buy any particular type of plan. We want to make sure that you're getting the coverage that's going to work for you and where you're at. The other unique thing is that coverage can start at one individual and it can go to unlimited. So, if it's you and your family, or if it's your business and you have 1,000 people working for you, or two, it really doesn't matter. So, it has unlimited coverage options, which is unique. So you can come in as an individual, or a large employer with a lot of employees, or a small employer with just a couple. There is no limitations on that. As we talked a little bit about the coverage options, but it is individual family plans, and then we have our group business solutions, which are for the business owner and their employees. It covers all of everything that we do: is major medical, the short-term options, Medicare, vision, dental, critical illness, accident, disability, life, and other supplemental coverages. Think about it kind of like an Aflac. We've all seen those commercials, things that are not covered by your medical insurance. Those are the types of plans that we have in that supplemental range outside of the vision and dental and disability, but some of the accident and hospitalization policies. All plans are based on you and your family's status, health, and financially, and that lifestyle aspect that I talked about. What you do. If you travel a lot, or you stay kind of close to home, we're going to be able to find that plan that makes the most sense for you. And I think our idea at the end of the day is we make something that's not fun for a lot of people, make it a good experience. It's all about getting health insurance and making it a great member experience, and doing it in a way that isn't going to take a lot of your time. And you're not going to have to spend a lot of resources on it. If you were to do this on your own and go out to all the different resources out there, you'd be spending hours and hours of finding, the different types of plans between major medical, the short-term options, vision, dental, and all those kind of things out there. We try to simplify that for you. When we do look at it from a business standpoint, as we've talked about a little bit, for those that are looking potentially for coverage for their employees, this is a group coverage option for a business owner. This is set up where it's affordable and has more flexibility than a traditional group plan. It's not group rated. It will work for all businesses of all sizes. It allows choice for both the business and the employees. We again use a framework called a HRA. There's two types of HRAs that we typically use. One is one they call QSERA, and that's a qualified small employer HRA, and the other is an individual coverage HRA. What we find typically is that the QSERA works for smaller businesses, but not always. The ICHRA can work there. But if you have a larger business, one that's had traditional group coverage in the past, the ICHRA is usually the better option. But this is where we would do another needs analysis with you and kind of find out the particulars on what it is that you're trying to accomplish. If you've been offering group coverage in the past, you've seen huge rate increases, which we found to be happening a lot lately, or you don't have as many employees taking health coverage, and your group plan's kind of pushing you away because you're falling under a minimal threshold. Really, those are the things that we can really be beneficial. Or if you've never offered coverage before and you have under 50 employees and you've not been required to offer health insurance, and you want to do it to stay competitive, both, in attracting new talent and keeping your employees, we can build a plan that's going to work for you. There's no set rates. It really comes down to understanding your financial, what you have budgeted, what's available, and we would work with you to make a plan work for your company, for your budget, and for your employees. But it takes the same type of approach, the concierge approach that we do for an individual member. We do that with your employees as a one-on-one, so that they're not going to just be handed a stack of papers from an HR director or the business owner and say, fill it out. And if you have questions, good luck. We're actually going to, take that holistic approach and work with everybody one-on-one to, make sure they're getting the coverage and getting the questions answered that they have. So when we look at, what is this program at the end of the day, on both the individual and on the business side, we have the HRA, the concierge approach for a business that's tax deductible for the employer. It's tax-free for the employee. Employer control, employee choice. Again, that's kind of the common theme with what we do, is it's all about choice. And for that group program or group solution for a business, it has the look and feel of a traditional group plan without a lot of the pitfalls. And it's something we can spend some more time on. But the idea is that it makes it a lot easier to offer a plan like this than a traditional group plan where you have just one insurance company at the top and everybody's getting the same type of coverage. Now we're looking at choice. So the next thing that we look at is how to access this program. If you are a member of IBPA, you've probably gotten at least an email or two here over the last 10, 12 months here that we've been offering this program. I think we're in the 10-month range right now. And typically you're going to have a link to a unique landing page for your program, as well as a unique phone number. So we encourage you to go to those. It's obviously in the back office or in the member only area for your organization's website. If you're not a member to gain access, obviously we encourage you to join. But when you do start looking at going to the landing page, going and calling us, the kind of the access points, you're going to get a no cost, no obligation quote. There's no high pressure sales tactics or pitches here. This is insurance coverage for individuals and families. It's that concierge approach. Same thing for a business, but you have access to a lot of the information we talked about today on that unique landing page. When you call that 800 number, you're going to get right through to a LIG licensed agent. They're going to be able to walk you through your options. If you're a member and you're on the landing page and you want to form fill, which is one of the ways that we find a lot of the members take advantage of the program to get this going, to ask for basically schedule an appointment. We're going to ask for basic contact information. Please know that we don't do anything with that contact information outside of talk about this program with you. We're not going to sell it. We're not going to remarket to it. We're not going to get it to anyone else. We don't use it for any other purpose other than getting that quote or establishing that quote for you. We're going to ask your basic contact information, and then probably more importantly is 4 questions that we ask at the end of those forms. But the type of health coverage options you're looking for, coverage options for you and your family, healthcare options for Medicare for you or a spouse, if you're a sole proprietor, independent contractor, or if you're looking at coverage option for your W-2 employees. By checking off one of those boxes or more than one, we'll be able to get you the right team member here at LIG, and they can quickly get a conversation going with you. What you're typically going to see after you fill out this form, you will get an email in about 24 hours. You get one initially just acknowledging that your form fill is received, but we'll send another one out to you that has the agent that you'll be assigned to. It has a link, a scheduling link, if you want to then schedule an appointment with your licensed agent, that fits your schedule and your time of day. This time of the year, we don't have weekend hours, but we do late hours to take into account West Coast, East Coast, all those kind of things. But that email, that second one that you get from us, will have the ability to schedule an appointment, or you can call right directly through to your licensed agents. Try to make it easy from that standpoint. So we've reached the kind of the end of the basic presentation, and at this point, I want to open it back up to questions. Chris, if you have questions that you want to jump back in on, I think we can start looking at those and answer any questions that people may have.
Yeah, so while people are sharing questions, I had kind of one general one. When people call to talk to you all about the different plans, is there stuff that they should have maybe things ready so that it makes the phone call easier?
Yeah.
Questions you're generally going to ask?
Yeah, that's a great question. Some of the basics. I mean, if it's you and your family, for that call, you want to get a quote going. We're going to need, everybody's names, obviously, their legal names, their social security numbers, and then, if you're looking at, wanting to make sure a doctor or a hospital or even prescription drugs are included in plans, have that information available. Who your primary care doctors are, any specialists that you may have, hospital networks, and then of course the prescription drugs that you're taking. And we can kind of go through and look at those. The licensed agents can, to verify that they're going to be included in any of the plans that we recommend to you. So up front before you even have you have to make a choice. Already that 2 of the 3 plans that we're offering or making a recommendation on are going to cover, all the things that you need to make sure are there with doctors and hospitals and prescription drugs. Those are probably the biggest things. And then, date of births too. I forgot to mention that. So everybody's date of birth.
And then what about like for employers, like what do they need to know about their employees? I doubt they'll
Yeah,
have
a
all
little
that
bit.
'cause
Yeah, a little bit different. I mean, for the first call, we really don't need to have a lot of that information. We'll go over that with you. We're typically going to ask for a census, or we'll be able to provide you with an Excel form where we need to get basic employee information. Where they live at, not necessarily their home address or anything like that at that point, but zip codes. If you've been offering coverage in the past, a lot of times you've already done a census, so we can utilize that. If you do have a current plan, we'd want to see about getting the overview summary, the coverage options that you currently are offering to see where it's at. We'll talk a little bit about your budgets, things along those lines. But on the first call, it's really just kind of making sure you understand how the program works, answering any initial questions, and then letting you know the things that we're going to need, seeing what you do have, and how we can help you pull all that together so we can put together a quote for you.
And Laura was asking, are all the plans ACA compliant that you all talk about and recommend and all that?
Yeah, I mean, well, that is the core of everything that we do, but we do have those off exchange plans, and that's going to come down to that needs analysis. But most of the plans that we have are going to be an ACA Obamacare plan, outside of those short-term plans that we did discuss. And then obviously Medicare is handled a little bit differently. I mean, they have their own, but they all conform to what is most people consider the ACA type plans. And if we're doing a business offering, we're going to do our group plan. They have to be ACA compatible plans. You cannot use any of the short term or any of the off exchange plans with those. They have to be an ACA compatible plan, which is what we would work with you and your employees on.
And so we have a lot of members that are independent publishers. So I imagine size is something that you all like keep in mind. I mean, obviously you have plans for if you have 100 employees or if you have 2 employees.
Correct. Yeah. So size, I hate to say it this way, but size doesn't matter. It really comes down to, what is it you're trying to accomplish? If you've been, say you have 100 employees and you're offering a current group plan, we're going to have some conversations about why you're looking to make a change. Are you looking to save money? Has your group plan, the rates gone up? If you have employees in multiple states, maybe you're not getting the kind of coverage you need for the employees that aren't at your headquarters location. Everything that we do is based on where an employee lives at, as opposed to where the business is located at, which is such a better way of handling it. So we look at a lot of those options, but the idea is that, it can be 1 or 2 employees. I mean, literally we can start with 1 W-2 employee and go to thousands. I think the biggest one we are working with right now is 650 employees.
And so if you're like an author publisher, how does that work in terms of, is it just become like personal insurance, or is it somehow related to you as a business entity, as an author publisher, like your career?
Well, it depends on, if you're incorporated or not. There's some of those things, and we can have some of those conversations with you. So if you're incorporated, are you going to claim it on your taxes, on the back end, or, depending on where you're at from an income level standpoint, and you're qualifying for a subsidy, you're probably better off doing that and getting basically the discount on the front end as opposed to taking it on your taxes. And that's just, really having that needs analysis with you to find out, what your situation is and what makes the most sense. Especially with the new subsidies that they've put into place, so many more people are qualifying for subsidies that have never qualified in the past as individuals or families. So it's time to definitely kind of re-engage on that and get a handle on, where you and your, if it's you as an individual or if you have a family, where you fall in that, to see if you're getting those subsidies as opposed to taking on your taxes if you're incorporated or, you're doing an LLC or, something along those lines. But we can
Yeah,
talk through that with you.
and then so a lot of our independent publishers obviously have authors. So authors are not employees, but I suppose if the author became an IBPA member, they would just get their own insurance and they would be able to be part of the program, but they're not in any way connected to the publisher, right? Like you have to be an employee of that publisher.
Yeah, to have it be, well, if you're going to have it where the employer, if you're truly a W-2 employee where they're going to help you pay or offset the cost, the expenses of your insurance, true. But if you're looking at where it's independent, someone's an independent contractor, they're not tied to you for, a true W-2 or anything along those lines. They would probably then need to be a member of IBPA. That would be a conversation to have. But the idea is that they could still get coverage through this program very easily.
And someone else asked, could you do an analysis of the independent publisher's current insurance program to see if there's a better option that you all can find in the market?
Absolutely.
Okay. So
Yeah,
then,
there's no cost for doing any of that. That's just, really scheduling some time with our team. We'll go through and do that, initial needs analysis, with you, get some of that basic information. And that first call takes about 30 minutes. And then, we'll collect some information from you, looking at what you're currently offering, where you're at from a budgetary standpoint, and then come back with some recommendations and, really getting a handle on, how you handle your insurance now. If you're doing it just for the employees, if you're offering it to employees and their spouses and children, all those elements come into play. But, probably the biggest thing is understanding, where you're at, and why you're looking to make a change. If it's, about choice, getting better, having more options for your employees, if it's about saving money, if it's about, offering it to different types of employee classes, that's something that's unique to the HRAs is that you can offer it to, a lot more subsets of employees than you could with a traditional group plan. So you can actually offer it to part-time and full-time. You can offer it to salary and hourly. There's just a lot more segmentation that you can do. And, it really, creates some unique elements for an employer and some potential for cost savings that they probably wouldn't see with a traditional group.
And for something like that, all they would need to do is tell you what, like the group plan, their membership number or something, and you on your end, your team can look that up, or do they need to kind of look up what their plan covers and share that with you?
Yeah, usually everybody has a plan summary that you've been given by your current group broker, and really we just kind of need that to understand where it's at. We're not necessarily looking to replace it because probably one of the biggest things to look at is for the different coverage options that are out there, what's available in the market. And what you're trying to accomplish. I mean, if you're offering like what would be the equivalent of like a platinum or a gold plan, we just want to kind of have a handle on that. And I think probably the biggest thing that we will look at with you is what is your budget? What is it that you're doing now? What are you spending per month, per year on your health insurance? What are you doing with your employees? Like how much of a contribution are you doing for if it's a 50-50 or you're doing 75% and they're doing 25%, or are you paying 100% of it? Those are the things that we need to discuss as well, and to kind of see how you want to have that moving forward. So just some of those initial questions, and then understanding what is the size of the business, how many employees take health insurance now, how many would be eligible that aren't taking, so your full company census, and then getting a handle on what is your current plan, so that we can make sure that we're looking at things apple to apple, and then kind of pulling in the oranges and lemons and limes to see what the other options are that are out there.
And when people, your information's on the screen right now. So are they going to be working with you, or do they? How often do they work with other people with LIG?
We have a team, but we will work depending on the size of the business, work with myself. Michelle Mead is our other group expert. So Michelle would, be participating in this. If it's a individual, like if you just need individual coverage for you and your family, we have a team of about, for IBPA, of about 12, 13 licensed agents that they would work with. So, really is going to depend on the situation if we're talking about a business solution or if we're talking about an individual solution. But, they're all our employees, and, everybody's based out of our headquarters. Well, honestly, some people are still working from home. We have about half of our staff in office, and the other half are still working from home with all the pandemic stuff that's been going on.
Yeah. So does anyone else have any other questions? I want to make sure to give you all time. Those are some of the big ones that I can think of. If not, that's totally fine. But I want to give you another minute while people might be thinking of questions. Tim, is there anything else that you want to mention about the program?
No, I think the biggest thing is, there's no obligation with any of the stuff that we do. So if you need, want to get a quote, you want to kind of kick the tires, see where things are at. It really doesn't matter, if your plan renewal is at the end of the year versus, a month from now. There's always, we encourage you to talk to us at any time. We can go through this and look at it for you, give you, an idea where things are at. And, if you're an individual and you're looking for coverage, or, if you've had, coverage, or if it's just not the right coverage, this is the perfect time, because of the special enrollment period, for individuals and families to readdress the coverage options that they do have. So, we're as I said earlier, kind of living in that unprecedented time, and, take advantage of a lot of these things that have come up over the last, 6-12 months to make sure that you're covered the right way, and that you, have the right coverage in place for you, your family, and for your employees. We're here to help and advise. That's the biggest thing. There's, it's not a high pressure sales pitch or approach on anything that we do. And, we can really just, answer questions for you and get you the information that you need, even if you're just kicking the tires.
Yeah, and on that note, so let's say, obviously right now it's a little different, but let's say it's not a special enrollment time of year. So if someone called you in July, no special enrollment, would you then need to, because you find plans that are available now, but come November, when open enrollment normally opens up around that time, wouldn't there be maybe new things? Would you need to do with another analysis at that time? How does all that work?
Well, it depends if we're talking about from a business solution or if we're talking about from an individual solution. Probably the biggest thing that happens, excuse me, in that November, December timeframe is, a lot of carriers are starting to add, markets. There had been a pullback a few years ago. A lot of carriers had dropped out of the individual marketplace, for example, and we're seeing them come back in. I think everybody's realized that the ACA or Obamacare is here to stay. And so we're seeing more of a more competition, which is good, because that typically means prices come down. But then they also offer, other coverage options, more coverage options. If you're happy with the plans that you have, you don't have to change. But at any time, in that open enrollment period, you can look to see whether there are other options that are available, if new carriers have launched in your market, things along those lines. So it's always good to kind of readdress it. You hear this advice a lot with like home and auto, to periodically do a check on making sure you have the right coverage options. I think the same thing holds true for your health insurance. You absolutely should check and change and update as needed, and that's something that we can do for you at any time, and with no added cost outside of your premiums.
Yeah. So then, is there a particular time of year that you recommend people, like, this is really the time to get in touch with you all? Because I
Well,
imagine
in a non weird year,
yeah.
it's that November, December timeframe for individuals, unless you've had one of those qualifying life events or something along those lines. So in a normal year, it's that open enrollment period. If for some reason you lost coverage, in the middle of the year or something like that, you usually have that qualifying life event, so you'd have access to all the ACA plans. If you just haven't for some reason had health insurance, or we see this a lot too with members of the organization, their child will age off of their parents' plan, and I hadn't really anticipated that when I built out our program, but it definitely is something that we see a lot of, and that's something that's another qualifying life event, so we can make sure that a child gets the coverage that they need affordably as well. But you do have coverage options all year long. Some of them are going to be those short-term plans. We usually use those as a bridge to get someone from, say, July over to the open enrollment period. So it really, again, comes down to time of the year and situation. But November, December is that crucial time of the year, especially for Medicare. Medicare is not covered under the special enrollment period, so their open enrollment period is October 15th through December 7th. So if you're Medicare eligible or going to be Medicare eligible, we encourage you to start reaching out about 6 months before you turn 65 and talking with our team to make sure that you're doing it all, because there's things that you have to do with Social Security and with some other things that people don't even think about. But we can walk you through how to get that taken care of so that you'll have the coverage in time, for when you turn 65. If you're a business owner, you can do it any time of the year, but there is no real open enrollment period. A lot of it's either tied to when your current, if you have a traditional group policy now, when that needs to renew, or if you've never offered a coverage plan before, you could start that at any time. Doesn't matter.
Okay, great to know. This has been very informative, as usual. Thanks. You're clearly, someone who knows a lot about this. So we appreciate getting to work with you and that this exists for our members. That's all the questions everyone had. So I really appreciate it. And thanks again for all the work that you all do to help our members find the right plan for them.
Appreciate it, Chris. It's been a pleasure actually, working with you and, all the members that we've talked to this point. It's always a great conversation, and we really do enjoy the relationship that we have with, your organization as well as the other, BIHIP members, all the other book and author and, publishing associations that came together to get this done. So again, appreciate that. And thank you everybody for joining us today. With that, Chris, I'm going to hit stop record, and I will turn over the reins to you.
Thank you.